Alright, so in this video we're going to go over the different muscles that are found here on the cat, and so we'll start here at the upper extremity and then work our way down. So what you're looking at, obviously this is an anterior view of the cat, and this large muscle that's here, this is the pec major. So you have the pec major here, and then what's here that's deep, this is the serratus anterior, and so you can see like the striations of it. Serratus is Latin for blade, and you can also see them right there. So then if you look at this muscle that's flapped, so this is the latissimus dorsi, that's what's going to, it's going towards where the humerus is. And then this entire thing here is the scapula, but this muscle that's right here is the subscapularis. So you have the subscapularis there. So then let's work our way downwards and look at some of the abdominal muscles. So if you look at it, let's see, where did I reflect it? Yeah, so we're going to identify like the external obliques. So the external obliques are here on the outside, okay, and so they call them obliques because of the angle. If you look at the way that the fibers run, you can kind of see it here, but on the internal oblique it's really obvious there. So see, the striations are going at an angle. So external oblique is here, this is the internal oblique. And then if we look here at towards the distal attachment of, so this is the rectus abdominis, right? It starts here at the xiphoid and goes all the way down here to the pubis region, but you can see the striations going downward. So it's rectus, right, because the striations are straight, and then it's in the abdomen. So rectus abdominis is there. So that's for the thorax. And then I have this guy here. This is on the back side, and so the trapezius. So the trapezius muscle it attaches here on the external occipital protuberance, which is up here at the top, and then it goes all the way down this way and this way to attach to the clavicle and then also the scapula. So the upper trapezius would be here. It's just cut at this part, but so yeah, backside of that. And then let's see about some of the muscles here in the leg. So it's not particularly obvious, but this is where the rectus femoris would be. So what I can do is, I know the reason you can just kind of like palpate up. So the AIIS would be up here, and then so the rectus femoris is like this one that's right in the middle straight. So rectus femoris would be here, vastus medialis would be here, and then lateralis is here on this side. And then if you work your way downwards, so this is where the tibialis anterior would be, because it's right next to the tibia, so you can see like the bones coming this way. So tibialis anterior is there, and then if you look at it laterally, so this muscle that's deep here, this is the soleus. So the soleus is there, and then this is the gastrocnemius. Here I can turn him over, and then you can see the medial and the lateral head of the gastrocnemius. So this is the lateral hamstring. So this would be the biceps femoris, and then the semi group would be here, the medial hamstrings right there. They're all going downwards here. So yeah, those are the medial hamstrings. And let's see, lat, traps. Let me turn this guy over, make sure there's nothing on him. Yeah, that's just the latissimus dorsi again. Okay, so that'll do it.